been tested.
And for the first time, the state released numbers showing how many people have recovered. Fox 59's Brett Cass shows us how our hospital system is making it happen.
Starting out first with our data.
Today it was announced that dozens more Hoosiers have died from COVID-19, but thousands more have recovered.
As concerning as any bad numbers are, these figures show us that a lot of people are recovering, and most people will recover.
Dr. Peter Emby with the Regan Streif Institute is in charge of collecting all the data. Of the nearly 8,000 positive cases analyzed, about 35% visited the emergency room. 26% were admitted, and about 6% went to the ICU.
I remember telling my wife, this is as bad as I've ever felt in my life.
Carmel firefighter Kevin Young was one of those patients admitted to the hospital. On average, most patients spend about 9 days there, but Young only spent 3. He's also one of the 68% of patients who were discharged, and now a month later, he's recovered.
It put me down. I mean, I was totally wiped out in every way possible from this thing.
About 12% of hospitalized patients died of the virus. But Dr. Emby says there are positives to take away. 75% of the state's ventilators are still available, along with nearly half of the ICU beds.
And I think that's what some of the numbers are telling us also, is that when people do need to go to the intensive care unit, they're going. When they need the ventilator, they're getting it.
Dr. Emby says that's because social distancing and stay-at-home orders are working. And if we continue, the light at the end of the tunnel will soon start to shine.
A lot of people have been infected. Some fraction of them have become so sick that they need to go to the hospital, but the vast majority of those people leave the hospital and recover.
Brett Cass, Fox 59 News.
We can expect more in-depth numbers in the near